So a lot of people ask me, hey, Dr. Tam, how did you become a chiropractor? You know, what drove you to become a chiropractor? I get asked that a lot in the office. Kids ask me that. Interns ask me that. Students, when I'm at conferences, people ask me why I became a chiropractor, and I thought I'd share that with you today. It all started off in 2002. And in 2002, I was on the track for pre-med. That's what I wanted to do. My family wanted me to be a doctor. I wanted to be a doctor. But in 2002, something changed. My mom was diagnosed with trigeminal neuralgia. And for a lot of you who don't know what trigeminal neuralgia is, it's as if someone took a needle and stabbed it in your face, boom, 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 multiple times. And every time it would hit her, and it would drop her to her knees. It was so painful. It was very, very intense. We went to the doctors, tried to figure out what was wrong. They didn't really tell us what the problem was or what the cause was, but gave us a lot of medications. But when the medications wore off and it didn't work, they'll up the medications. Eventually she got shots around the head, cortisone shots, Botox shots. There were other shots in there, steroid shots that she had to try to numb out the pain. But years and years go by. 2 years went by. In 2004, the pain has not improved. And they said, you know what? This is time where we have to cut the nerve. We went home and said, what are the risks of getting this nerve cut? Asked the doctor about it. They said, you know what? She could lose sensation to half her face. She might not be able to move half her face. We're like, whoa, that's not something we want for mom. And mom didn't want that. That's where we kind of draw the line and said, this is not working. Nothing we have done is working so far. The pain's only getting worse. That's when we started talking to friends and family, and one of the family friends says, you know what? You ought to try a chiropractor. And we thought, a chiropractor? What does a chiropractor have to do with pain in the face? And they said, you know what? Just try them anyways. So this chiropractor was far away. We had to travel over 3 hours to get to this chiropractor, who was referred by a friend. And you know what? Let's try it. At the time, I was still studying pre-med in Davis. So I went from Davis to Oakland, picked mom up, and then drove another 2 hours to get to this chiropractor. We went in the morning, and I remember it vividly. We went in the morning. Chiropractor, he had to take time to analyze the x-rays, but knowing that we came from far away, we went in the morning. He says, go have lunch, come back in the afternoon. When we came back, he looked at the films with us and told us that your mom sustained a pretty severe injury, probably when she was a teenager, maybe in her early 20s. Mom didn't think much of it and says, you know what, if that's the problem, let's get her adjusted. But I'll tell you, while she was getting adjusted, it was almost like a light bulb went off, where she remembered that in her teenage years, she fell off the bike, her head hit the guardrail, and got up, didn't think much of it. Well, ever since then, she's also gotten into a couple of car accidents that she didn't think was a big deal. She never went to the chiropractor, took some medication, that was it. But in her 50s, early 50s, that's when the trigeminal neuralgia hit her. As we started going to the chiropractor, we were going 2 hours away, 3 times a week when we first started going. But I'll tell you what, at about 2-3 weeks in, this was the first time my mom felt better. And we started seeing life in her eyes again. She wasn't getting the pain as often. Now, mind you, 2 years went by, and this is the first time there was a difference. By the end of the first month, into the second month, she was barely having the pains that she was having multiple times in a day, to now once or twice in a week. Whole life change. And you guys know, when mom's life is better, everyone's life is better. I asked the chiropractor at the time, I said, I'm so thankful for what you have done for our family. What is it that you do? I want to do what you do, because it's made such a difference in my mom's life that there's got to be a lot more people out there needing chiropractors to work on their body to help them get better. And he says, absolutely, absolutely. So I went and switched from pre-med and went to chiropractic school, did a 4-year chiropractic program in 3 years, graduated in 2008, moved to Vacaville in 2009 and started our practice from there. May 27th of 2009 is when we started our practice. And I'm so thankful that we have patients that has been with us since 2009, 2010. And I'm very eternally grateful for that. But I owe my profession, or our family, what my mom has went through to chiropractic, and that's why I'm a chiropractor today. You know, I started taking care of a lot more kids and children and prenatal moms in our practice really when my wife got pregnant, when my little one was born. And that's where I learned the skills and honed the skills to adjust kids and also prenatal and the pregnant mommies, you know, that come through our office every single day. So that's my story of why I became a chiropractor. I hope you enjoyed it. I hope you watch my other videos as well. Have a great day.